And now we are going to move on to the second panel discussion. Today, to again echo Mr. Ni Nami's notes on how trust is very important. Trust is also the founding stone of partnerships. So the next session, we have a topic, it's Partnerships for the Pacific, Navigating Climate and Health Across the Blue Continent. And to begin, I'm pleased to welcome our moderator to the stage, Ms. Silva Shih, Managing Editor of CommonWealth magazine. Please join me in welcoming our moderator for this session as Ms. Shih is making her approach to the stage. I would also like to welcome her fellow panelists to this session to join the moderator. So Sir Collin Tukuitonga, Senior Fellow at CAPRI and Co-Director of the Center for Pacific and Global Health of University of Auckland. Welcome. Also, Ms. Roannie Shiu, Co-Director of the Center for Pacific and Global Health of University of Auckland. Welcome. And also Ms. Emi Chutaro, Executive Director of the Pacific Islands Health Officers Association. So I see that our moderator and our panelists are comfortably settled in. And this panel will start in a different fashion. We are going to have an introduction by Dr. Ching-Yi. Dr. Ching-Yi is the Deputy Minister of Health and Welfare of Republic of China, Taiwan. And she is also the former coordinator of the Taiwan Medical Mission in Tuvalu. And now, please put your hands together and join me in welcoming Deputy Minister Lin to the stage. A round of applause, please. Thank you, Dr. Lin. And we look forward to a thought-provoking session with your introduction. And now the floor is yours.
Thank you, Charlene, our panelists, and our distinguished guests, ladies and gentlemen. Good afternoon. I'm Ching-Yi, Deputy Minister of Health and Welfare. I also was a legislator, member of Social Welfare and Environment Hygiene Committee, and member of Foreign and National Defense Committee. I am the first legislator hosted Sustainable Development Goal Committee and Civil Defense Committee in Parliament. And just mentioned earlier, I was the mobile medical team missions in Tuvalu in South Pacific. It's my honor attending this forum to share my experience and perceptions in South Pacific Public Health Cooperation. And our program is supported by Ministry of Health and Welfare. And I would like to extend my observation about the importance of international cooperation, national security, and Austronesian Language Families Alliance for Taiwan. Is not only for networking, but more important, it is identity of our country. I was gynecology and obstetric doctor before my political career. It's so privileged for me to join the mobile medical team experience in Tuvalu since 2008 to 2013. Yes, I really thanks for the important opportunity for me to join those missions. I always remember I am and my colleagues, my hospital colleagues, first time to know where is our South Pacific diplomatic countries. And the first time to know, Tuvalu is so far from Taiwan. We need to fly there 2 days, 4 trips. The first time we know, and the first time we have the culture shock. Not only medical equipment, lifestyle, and environment. So actually, I could talk about all those experiences for hours. But the very important in past decades, Taiwan is lack of the opportunity of international participation, absent from international organizations, absent from international meetings, absent from formal community and the negotiation channel. So actually, for our young generations, they really lack of the global cooperation opportunity, lack of the information, especially from UN, from WHO, from the global societies, and the very important programs, cooperations opportunities. Actually, is really unfair to our young populations and unfair to all the Taiwanese people. So maybe this recent we talk about the tariff challenge. Actually, maybe that is another kind of chance for Taiwan, just like the COVID pandemic. We are clearly having the same position and even new opportunity for cooperation, negotiate, and bargain. The medical mission with our diplomatic countries since 2006. The public and the private hospital cooperated with ICDF, provide medical training, medical services, medical equipment, drugs donation for our diplomatic countries. And the programs shift to Ministry of Health and Welfare since 2015. So we have Taiwan public centers, public health centers, Taiwan medical programs, Taiwan medical teams in our Pacific countries to help our friends in children nutrition programs, diabetes control, dental health, chronic disease control, and digital medical management, and the laboratory quality improving programs. And very important, we also provide medical doctors and nurses training programs for our diplomatic countries in Pacific. So during pandemic, all this hospital also provided digital medical services for helping our friends in disease control, chronic disease consultation, and the vaccination knowledge training. I really hope I could let you know how deep relationships and the friendships between these countries, people, and our medical workers in those very important cooperation programs. But in another side, is very important is Taiwanese actually we real to realize we are also authoritarian language families. We are sisters and brothers with the Alliance of Pacific countries. So when I first realized that the very important history and the culture and originals, actually I recognize that what is real Taiwan's identity. So when we think about that, to understand that, we were to rethink about the position of Taiwan, not only geographically, but also history, original, culture, and the relations with our South Pacific friends. The more connected with our Pacific friends, the more we realize the real Taiwan's role in the region and in the global. So I always believe Taiwan could be and should be the partner of the international society in public health, in regional security, digital technology, and even in blue economics. So very happy once again. Thank you. Today could have the opportunity to join this forum, and I always believe the South Pacific is our very important partners and very important original place to reach out the more cooperation with global society. Thank you.
Thank you. Thank you. Please put your hands together to thank Dr. Ching-Yi, Deputy Minister Lin, for that very kind introduction, for sharing Taiwan's valuable experiences in fostering climate and health partnerships. And now, Ms. Shih, the stage is fully yours.
Thank you so much. So I am Silva Shih, Managing Editor with Taiwan's CommonWealth magazine, and also today's panel host. I'm going to moderate the panel called Partnership for the Pacific. And why this issue matters, someone told me it's also called How to Stay Together Stronger in this Complicated World. So today, our three panelists are going to walk us through how they adapt and how they thrive. But most importantly, they are a part of a global alliance called Partnership for Health System Sustainability and Resilience. And CAPRI is also one of the participating alliance. Last year, CAPRI and three of our panelists actually worked a report that explored the potential risks and also opportunities in the Pacific region. So before we dig into the research, maybe I should introduce our panelists first, from my left to right. The first one is Sir Collin Tukuitonga. And the second one is Roannie Shiu. And the third is Emi Chutaro. So let's start with our discussion with Sir Collin first. Can you walk us through briefly about the highlight of the research I just mentioned, and what have you found that you think you have to share with our audience today?
Oh, thank you very much. As has been mentioned, the three of us and others were part of the report, the PSS report on 3 islands from the Pacific, the Kingdom of Tonga, the Republic of the Marshall Islands, and the Republic of Vanuatu. Just briefly, the Pacific islands, of course, face a number of challenges. The most important is the tyranny of distance. Small populations scattered across the largest body of water on the planet. Very small health systems, largely dependent on government contributions, inherited over the years based on an infectious disease predominance. The problem in the islands at the moment, of course, is 80% of the deaths are due to chronic diseases, diabetes, heart disease. So in a way, the existing health systems are no longer fit for purpose. People with chronic diseases live a very long time with 1 or 2 chronic conditions. They don't need to go to expensive healthcare facilities. Climate change has been referred to this afternoon, and it is one of the serious aggravating factors to healthcare delivery in the small islands of the Pacific. Climate crisis makes more difficult what already exists. Let me give you an example. It's pretty difficult to get clean water in small island states, atolls, even at the best of times. And when you have climate change, climate crisis with rising sea levels, saltwater inundation, getting access to clean water, it becomes even more difficult. I should also say that the climate crisis is an issue of fairness and social justice for people of the Pacific. They contribute less than 0.03% of the harmful greenhouse gases, and they're the people who are living the dramatic effects of climate change. My colleague will talk some more about that. But in terms of the report, I just want to highlight 3 key things. One is financing of small health systems is largely reliant on taxpayers, public funding. And many small islands struggle to balance the need to fund education, police force, and so on. And so many of the small islands spend less than 5% of GDP on health. There's no magical figure as to what you should spend. But generally speaking, if you spend less than 5% of GDP on health, it's very difficult to provide basic care. The fact that immunization rates in the small island states is very good is really a testament to the commitment of healthcare workers. So financing healthcare services is a major problem across many of the island states. And when people go to tell them, well, you should fund more of this and more of that, it's a pointless exercise. Because the poor old Minister of Health, where's he going to get the money from? It's not possible to generate more money from local sources. Because if you say, Minister of Health, please, sir, Minister of Finance, may we have more money to do this? You really should say to them, and you could do less of that. That's the conversation. No point writing a long shopping list of things to do when there is no money in the kitty. Financing of healthcare services in the region is a major problem. Huge reliance on out-of-pocket expenses. And what that means, of course, is the people without the money, and often the people who need healthcare the most don't have the money. So there's a real challenge to an alternative arrangement, some options for financing healthcare better in the region. The second big issue I want to highlight is the chronic loss of trained healthcare workers. The New Zealand health system and the Australian health system wouldn't work without trained healthcare workers from the region, particularly nurses. I know the healthcare workforce is a global phenomenon, but the Pacific Island nations have suffered chronic loss of trained healthcare people. And there's been codes of conduct and good practice in the recruitment of people globally. It's just a paper exercise in my view. People are pressured to do the best they can for themselves. And I do think this is where the conversation needs to be had about bigger nations, wealthier nations doing the right thing. Stop poaching, stop taking from very small workforces in the islands and do the right thing. Look, I could go on, but I should stop here. Thinking about opportunities, there is a problem of reliable, consistent supply of proven medication in the islands. And if Taiwan business, others are thinking about opportunities supplying affordable, proven, cost-effective medication for common conditions like diabetes and heart disease is one opportunity. The second, of course, we hear a lot about Taiwanese technology. I've heard a lot over the years about what telehealth and telemedicine can offer, but it's still largely science fiction. I read something the other day about the AI doctor will see you now. It sounds good in the newspapers, but is it really an option? So the minister was very kind, and I thought she was quite correct in perhaps Taiwan and other countries considering additional support to medical care, nursing, trained people, as well as exploring, of course, technological options. Thank you very much.
Thank you, Sir Collin. I'm sorry, we have only 20 minutes for the panel, but I believe we're going to have longer one next year. So, Roannie, so since Sir Collin touched a little bit on that issue, maybe you can talk more on how do you see the climate change affect the healthcare system and also economic resilience in the region, and what opportunity you've seen that you can share with our audience today?
Thanks for the question, and I think in terms of the impacts of climate on health and economic resilience in the Pacific, Sir Collin is correct in that we face the biggest impact from climate change. What that actually means, though, too, is that we have more adverse weather effects. This impacts on our infrastructure, and particularly on water and sanitation, as Sir Collin has mentioned. And so by 2030, the Pacific will not be meeting its SDG target, where 1 in 6 people can have access to basic drinking water. And so when you are experiencing frequent weather events that decimate your population, that decimate your infrastructure, that decimate your food and your livelihoods, building back better is really difficult and becomes an ongoing challenge, and it is quite complex. And so thinking through both the health and the economic resilience of Pacific people is quite imperative. On the flip side, though, in terms of opportunities, is the fact that our population is quite a youthful population. So half of the region are under the age of 23 years old, for example. And so what that means, though, is that for the region to be prosperous, we also need a stable environment, we need stable political stability, but we also need economic opportunities. And I think this economic opportunity comes from partners in this room. And, you know, this is my first time in Taipei in Taiwan, and we hear a lot about this rhetoric around islandness. And I think leaning into what Minister of Health had said about our deep historical connection with Taiwan, but also with other islands like Singapore, Philippines, Japan, I think there is really room and scope to provide a balance of power, or at least provide the Pacific with a better shot in terms of thriving. We know that from the IMF, they have said that the Pacific would need at least $1 billion per year in order for us to adapt to the constant change in climate. As Pacific people, we have navigated, you know, the biggest expanse of water in the world, and we did this, you know, with very little advanced technology. But what we can't do right now is actually adapt fast enough to people polluting, emitting greenhouse gases. And so this actually needs global cooperation, collaboration, and actually moral will. You know, people doing the right thing, doing good things for others. And so, you know, we heard a little bit about Trump and thinking about America first, but, you know, is it going to be a great America if there's no one else to enjoy it too? And so I think I'm looking out and I can see some young people from the Pacific region, and they, you know, this is what we're doing it for. We're doing it for our future children. We're doing it for the prosperity not only of the Pacific but also of the globe. And I think global cooperation, alliances, and people just doing the right thing is really important.
Thank you, Roannie. Hello. Yes. So thank you so much for touch on the issue about the geopolitics, which is going to be the main theme about this forum. So Amy, you're going to be the next speaker for my following question. The thing is, we've seen the trend that the retreat of the U.S. leadership in not only in global health and also the climate governance. I'm wondering, how does that affect the Pacific nation, and how to give you the longer support of that?
Shih, Silva. I think I've got one of the more challenging questions, I think. First of all, as an organization based out of Honolulu, Hawaii, we are 98% funded by the US federal government. So in some instances, I'm going to be saying a few things that I know will be a little sensitive for us, obviously, going back home. But, you know, as many of you know, the United States has issued a number of executive orders, you know, within its 100 days of administration. And a number of those executive orders really targeted a number of not only global programs that support healthcare initiatives, health diplomacy across the globe, but also even domestically within the United States. And so we know from the media what's happening with USAID, for example, that have supported a number of initiatives in the Pacific region for health system strengthening, particularly in the natural disaster and climate change arena. And so that pullout is having a domino effect that we're seeing across a number of partners in the Pacific region and Asia Pacific region as well that have been supported by USAID funding. In addition, one of the executive orders was to pull out of the World Health Organization. And you know, a number of our partnerships, you know, were with the Western Pacific Regional Office here in the region in Manila. And so a number of us have been notified to no longer engaged with the World Health Organization. So with a number of our activities and the budgets that we're having to submit, we're having to actually delete WHO out of a number of those budget submissions back to our federal funders. We're also seeing a number of nonprofits, both international as well as domestic nonprofits in the United States that not only work domestically within the United States, but also globally as well, are also being impacted. A number of funding programs that are supporting humanitarian assistance more broadly are also facing a lot of notices for eliminations. And so what we're seeing is a time of chaos, a time also now of survival. And where can we find those other leverages to be able to keep our heads above water? Domestically, I also want to note that a number of the administration's policies have been to what they call reduction in force. So there's a number of federal agencies that are being targeted at the moment for a quite extensive reduction in force. So just recently, within the last few months, nearly 20,000 staff from the U.S. Centers for Disease Control and Prevention were given termination notices. Not only our CDC Global Health colleagues, but also our CDC domestic colleagues as well. We're seeing a number of public health programs that are also being completely eliminated. So a really good example is the Pacific Islands team for chronic diseases within the Center of National Chronic Disease at CDC have all been either terminated or have been shifted and reassigned to other positions. And of course, that's going to have an impact on us in the Pacific region that rely on the Pacific Islands team to be able to coordinate funding and technical assistance to the Northern Pacific in particular. We're also seeing a number of other programs, that are sort of core to, epi intelligence and to, laboratory services, as well as to lead poisoning, surveillance and prevention activities. I could go down the list. There's a very extensive list of a lot of different programs that are currently being impacted quite severely, either in terms of severe reduction in staffing or just wholesale 100% eliminated. And right now there is a lot of fear. You open your phone and you just don't know, which colleague just got their termination notice yesterday. Just this morning, a colleague of mine just indicated that she had gotten her termination notice a few hours ago. So we do not know what really the future is going to be at the moment, because these reduction in force, this targeting of staffing reductions within the National Institutes of Health, within CDC, within Food and Drug Administration, within the substance abuse and mental health programs, and the list goes on. The question is, what next? And what are we going to be able to see will remain? And from there, where we can then continue to nurture and to leverage and to make sure that those remaining programs and those remaining staff that we can work with in the federal government, can be supported as much as possible to be successful in their work. So I think the big question really is now about the evolution of understanding the chaos, knowing what's going to be available within the next days, weeks, months, years, to then where can then we then rebuild, ensure resilience, and ensure sustainability of public health interventions and healthcare interventions, not only across the Pacific region, but even domestically within the United States. So I think I was very, very heartened by Ninami-san's ending point there, where he said, one of the things that would be really important is, for private sector to be an active contributor to health, to be an active partner in health, because we cannot rely on government. That's clear. But it's not just the current U.S. administration. I'm talking about any government. And I think that private-public partnership, with health, folks have said, climate change is a shared burden. Well, health is a shared burden as well within that. So how can we explore those partnerships? What are the next steps? And at the end of the day, where can we survive and thrive together as nations and as human beings who need to protect and take care of our families, our children, our elders, and our community at large. Thank you.
So thank you so much. So I know our time's up, but before we wrap up this session, could all of you give us one sentence or one takeaway that you wish our audience to remember from our discussion today?
One of the things that we haven't mentioned is the fact that the US is threatening the solidarity of the Paris Agreement. The Paris Agreement is a global, collective agreement to do more for climate change. And it's very important that the non-US members of the global community step up and honor the commitment to the Paris Agreement. That would go a long way to relieving or alleviating the plight of Pacific folk suffering from facing the consequences of the climate change, not from their own fault, but in fact the actions of others who should really be doing the right thing.
Paris agreements. What about Roannie? Do you have one takeaway for our audience?
There's definitely a lot of room and opportunity for innovation and partnerships between all island states to build resilience, or I guess maintain resilience, because we've always been quite resilient people. And I guess the theme is on building resilience on shaky ground, and I would just add, and through choppy waters for the Pacific region. Thank you.
Amy, you are not the last. You are the important ones.
Okay, I'm going to stick my neck out a little bit here, and I want to really highlight one particular thing that maybe for most folks don't really know. When we look at the military, here in the Pacific region, and you look at the participation in those military, one fact that is often really not well understood is the number of Pacific Islanders that are represented in our militaries in the region. So the United States military, Pacific Islanders from the Northern Pacific are, on a per capita basis, are actually the largest ethnic group that actually is in the military. Same also in Australia and New Zealand, you have a very high proportion of Pacific Islanders who are serving in the military. And so when we are talking about strategic defense and we're talking about the potential to really look at resilience and partnerships, and hopefully we will not have any conflicts, but one never knows. But I think what's really important for folks in this room to know is that if there is going to be conflict, that the Pacific Islands are going to be in those military forces. They are going to be laying their lives down, for the health and for the life and security and protection of the Asia-Pacific region. So Pacific Islanders are actively putting their lives on the line to be able to protect not only Oceania, but our region writ large. So I wanted to sort of highlight that because, again, I think we really need to look at sort of the seriousness of some of these issues, and that the investment in the Pacific region is not just only an investment in health, it's also an investment in protection. Thank you.
Thank you. So thank you all of our panelists for their insights, and to you as well for being such an engaged audience. Thank you again. Thanks.
Thank you, ladies and gentlemen. Please join me in thanking our moderator and panelists for raising these very important issues. Indeed, we face choppy waters and shaky grounds. Thank you very much.